If there's anything that I think the American people are learning during this horrific crisis, is how weak and how dysfunctional our current healthcare system is. Because what we are seeing is not just that millions of people are losing their jobs and their income, and that is a terrible tragedy. But when they lose their jobs, they're losing their health care as well, because under this system, employer based health care, you lose your job, you lose your health care. Now, that is pretty crazy. So I think what we are seeing is Americans from all across the political spectrum are now understanding that your health care cannot be tied to your employment. It has to be seen as a human right. And that, of course, is what Medicare for all is all about. You get health care because you're a human being and you live in America. And that's comprehensive health care. And at the end of the day, it is a far more cost effective way of providing quality care to all of our people. Now, in the midst of this crisis, as I work with other members of the Senate on a new economic emergency package, I can't tell you that we're going to be able to put a Medicare for all bill in that. You can't do that. But what I can tell you is that we will fight to make sure that Medicare covers all of the out-of-pocket expenses for all Americans during the length of this crisis. And then afterward, we're going to proceed and continue that fight for Medicare for all. But during this crisis, what Medicare must do is provide health care to all people, 87 million, who were uninsured or underinsured before the crisis, the millions more who have lost their insurance, the people who have private insurance but have high deductibles and copayments and high prescription drug costs. During the crisis, Medicare should be able to fill all of those gaps and make sure that no American has to pay any out-of-pocket expense. So that's where we are right now. Let's stand together during this crisis. Let's do everything that we humanly can to protect each other, to keep healthy. And let's also use this such frightening moment in American history to rethink the basic structure of our society and where we want to go when this crisis is over. So everybody, stay healthy. Talk to you soon. Take care.